Welcome to Public Health America, a weekly program produced by BronxNet in partnership with Mercy College. I'm your host, Dr. William Latimer. Here on Public Health America, we speak with experts from an array of specialties across the liberal arts and health professions to provide you with not only the best science, but practical tips to live a healthier life. We also celebrate what studies have long documented, namely the unparalleled value of a liberal arts college education by setting the stage to pursue a career of your choice, increase lifetime earnings, and engage in civil debate. Our experts will share decisions they made and support they received that helped them to beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. With me today is Dr. Alyson Moadel, Epidemiology and Population Health at Albert Einstein College of Medicine. Alyson, welcome to the program.
Thank you very much. Pleasure to be here.
Pleasure to have you here. Thank you. So I know you've been doing some cutting edge work on psycho-oncology, much needed, both in terms of early detection of cancer and trying to serve all populations, but also underserved populations. Tell us a little bit about your work.
My pleasure. So I'm a health psychologist, and I specialize in the field of psycho-oncology, which is basically addressing the psychological aspects of living with cancer. My interest is in promoting physical, emotional, and spiritual well-being of those facing cancer, but I'm also interested in addressing health disparities by promoting early detection. So I work in the Bronx. It's one of the most disadvantaged financially boroughs in New York City, also communities in the United States. And my goal is to make sure that there's equity when it comes to psychosocial care, access to cancer care and cancer screening, and mental health wellness. And I know you're a psychologist, so you know how important that is. So it's exciting to be able to work with the community and make a difference.
That's great. So let's talk a little bit about the epidemiology, if we might. In terms of the Bronx, what are the rates of cancer? Are there certain cancers that are disproportionately high or low compared to other urban settings?
It's a good question. There are certain cancers that are disproportionately high. We have higher levels of cervical cancer, liver cancer, some tobacco-related cancers, and partly because of health behaviors. Some of it is due to lack of access to healthcare, maybe being underinsured or uninsured. But the biggest issue is that our patients are often diagnosed at later stages. And then when I say our patients, our community is primarily a community of color. So we have African American and Hispanic patients that are often diagnosed at later stages. So we're really working to, address that, through education, outreach, peer navigation. I have a program called the Bold Buddy program. I'll talk more about that in a few minutes, but it's really having cancer survivors reach out to newly diagnosed cancer patients or the community members to say, we're here for you. We're going to navigate you through. You're not alone.
So, you mentioned the importance of early detection, and obviously it makes complete sense. I have been in so many of these programs across an array of disorders and conditions where there seems to be a common theme emerging, regrettably, across different disorders, conditions, et cetera, challenges, strengths, opportunities, where folks just aren't getting the assistance they need. People talk about distrust or the lack of outreach. I mean, how are we really going to move the needle on this? What are the efforts that you're undertaking because the Bronx, 1.4 million people, right? Or something along those lines. How do we move the needle with such an important problem?
It's such a good point, Bill. And medical mistrust is a big issue. And it's, unfortunately, it's understandable because of historic abuses in research from years ago. So we're working to bring our scientists closer to the community. So the scientists can learn from the community. We can increase kind of community literacy as well as increase scientific literacy in the community. It has to be a partnership. It can't just be, this is what we're doing and we're giving it to you and you got to sign here, on this consent form. It has to be a dialogue. So we are really creating a community scientist advisory board. So, it's going to take time, but we want to hear the community's concerns. We want to know how we can help them and reach them and explain what's going on.
I remember, both here in Philadelphia, where Chestnut Hill College is, and the Bronx, where Mercy College has a campus. We've done quite a bit of outreach, and many of our students are Spanish speaking, and many of their parents don't speak English. Do you encounter that? And again, when you're trying to engage folks in healthcare, if you don't even speak that person's language, it seems like it might be an uphill battle. What do you see in terms of your work?
It's a really good point. And the Bronx is over 54% Latino and about 30% are Spanish dominant. So they speak Spanish at home. So what we do is we work with the community. A lot of the members of my program, the BOLD program, the Bronx Oncology Living Daily program, are volunteers and cancer survivors from the community. They're pre-med students, and many of them are from the cultural communities of the Bronx. So they're Hispanic, they speak Spanish, and so they help build that bridge. It is important that we can speak the language, especially the dominant community in the Bronx, is Latino. So it's about meeting the community where they are. It's really being on the ground and ensuring that all of our materials are in English and Spanish, that they're reviewed by Spanish-speaking community members to say, yes, this speaks to me. So it's building relationships with community. It's all about being on the ground.
Yeah, are there health professionals at Einstein or major hospitals in the Bronx that have significant numbers of Spanish-speaking staff?
Absolutely. I mean, at Montefiore, I don't know what the percentage is, but I would say probably at least 50% of our staff members come from the community around Montefiore and Einstein. So they are, from those communities, Latino, African-American, immigrants from different countries, which is really wonderful. We have a large Albanian and Bengali community in the Bronx. So they're definitely, it's a diverse group. So they are huge help. They're absolutely huge help in making that cultural connection to the community.
So very good. So tell us a little bit more about your program itself, and what do you see? I mean, you've mentioned the importance of partnership, community outreach in a way that's sort of a two-way street, not a one-way street. The importance of language. What do you see? Are you charting rates of disease, rates of progression of disease, rates of mortality by virtue of folks getting to care too late, and then trying to move those needles, or is it just more at the beginning phase of your work to just kind of get the communities together?
Well, so we're doing both. I'm a psychologist, so I look more about the community building and the psychosocial aspects, but I work hand in hand with the epidemiologists and the physician scientists who are looking at what's called timelines of care. Are we getting patients in early for screening, early for treatment when they're diagnosed, early for long-term follow-up care? That's really important. What are the barriers to that? Sometimes are depression, anxiety, medical mistrust, lack of health literacy. So I work from that end, looking at the barriers, trying to empower and educate the community. My program is, as I said, the Bold Cancer Wellness Program and the Bold Living Program. And it was developed by asking patients, doing a needs assessment, a psychosocial needs assessment, asking patients what they need to help them sort of cope with their cancers. And the patients were saying, I want to talk to somebody who's been through it. I want to know somebody that's like me that's been going through this. So that was a huge part. So we started this Bold Buddies peer navigation program. And that's huge. I mean, they are out in the community, they're in the clinics, they're inpatient visiting patients. We have a Bold doula program, end-of-life doula program. So we're really making sure that we're connecting with our patients at all stages, pre-cancer to the end of life, to ensure nobody's alone and that they have the care and the advocacy that they need.
No, that makes a lot of sense. I mean, definitely the notion that there'd be the importance of having lived through what you're trying to assist someone through makes complete sense to me. So what do you see as next steps of your work?
We're doing needs assessments all the time. So we are trying, as I said, to get into some of the cultural communities that have a little bit more stigma around cancer. They don't like to talk about it. So if you don't talk about it, you don't often get the best care. So as I said, the Albanian community, the Bengali community, there's a lot of values around modesty. So, getting them in for breast screening, things like that, prostate screening can be a little bit of a barrier. So we're trying to get community members from those communities to talk about their own experiences. And those are, again, the peer navigators are the most powerful tool we have. So, we want to make sure that people from other countries feel welcome and that they know our doors are open and the care is for them as well, whether they're documented or not.
So you given the newer communities that have made their way to the Bronx, say in the last 3 to 10 years, is there an evolution there where it just takes time to start building that trust with a new, ethnic group that comes in, or is it a long-term problem also that whether you're African American or Latino, that there just might be a kind of distrust? Is there any time issue about the probability of engaging?
I'm hopeful. I think that everything takes time. Building relationships takes time. And, but we've made inroads with the Hispanic communities that have been here for many, many years and, generations. We'll make inroads with the other communities, but it will take some time. And as I said, as it's about giving and not just taking. So when we go into the community, we always ensure that we're not just saying, hey, take this survey. It's always like, how can we help you get the services you need? So we're not just asking for data, but we are actually, saying, we want to help you. We want to navigate you through whatever you need. So I think that's important. And it does take time, as you said, and we have to be patient. And I think that's my biggest challenge, is that I have to tell my colleagues, my scientist colleagues, like, it takes time. We can't just jump into the community and start a clinical trial. As much as that could help our communities, we have to build the trust so they know that the clinical trials are safe for them, that they feel safe, participating.
Makes a lot of sense. We're going to take a quick break. When we come back, Dr. Alyson Moadel Robley will tell us a little bit about her undergraduate experience and education and how that set the table for the great career that she has today. We'll be right back. This is Public Health America. I'm your host, Dr. William Latimer.
news, radio reports, and newspaper headlines in the 1970s and 80s misrepresented communities in the borough of the Bronx. Then, something transformative happened. By, for, and about the Bronx, BronxNet was born.
We are BronxNet!
BronxNet provides media education,
opening the doors to competitive careers in the media industry
for thousands of students in middle school,
high school,
and college. BronxNet.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. So, Alyson, on this second part of the segment, I always begin by asking our guests the same question, which is, where were you born? And tell us a little bit about your formative experiences.
Sure. My pleasure to answer that question. I was born in Danbury, Connecticut. And my formative experiences really involved growing up with a single mom. My parents got divorced when I was 2. And like probably a lot of you out there, it was really just my mom, myself, and my brother. And the biggest formative experience is my mother was diagnosed with breast cancer when she was 31 and I was 7. So at that time in my life, I didn't understand what it was. I knew that there was some deformity with her breast, but I didn't really understand. She recovered from that, and then it recurred when she was 40 and I was about 14. She went through a lot of different treatments. This was years ago. She survived for a couple of years and she died at 43, and I was just a week shy of 17. So the big experience for me during that time was that she was drawn to a lot of groups, support groups, and finding people who've been through it and, looking for ways to get support. And so she dragged me to some of those. And so I would go to a support group with her, with other family members. And it made a huge difference to me as a teenager. And while her death was extremely painful and tough, it also set my career in motion because I knew I wanted to help other people going through it. So I always say, our hardships can be our best teachers. It's been a teacher for me. It's also, made me take a career helping other people facing cancer to make meaning out of my loss of my mom's life.
I'm very sorry about the loss of your mom. That's obviously a heart-wrenching story, and but you take it someplace which takes a lot of bravery, I think. Tell me, in terms of, so you lost your mom at about the time when someone typically goes to college. What, tell me a little bit about what that transition. When did it happen? Where did you go? And you must have been suffering when well, let me start this. Did you go to college at a traditional age, or did you go later?
No, I went to college at a traditional age. I was in an unusual path because I wasn't actually planning on going to college. So I'm a very unusual person because my mother, she had a 2-year degree, but at that time she was sick, so she wasn't pushing me to go to college. And because I wasn't living or really in touch with my father, I was just going to get a job. But when my mom died, I was 17. I moved in with my father, who is highly educated, is a physician, and ended up being pushed by my father and stepmother to go to college. So I was 17 thinking I wasn't going to go to college. And then all of a sudden I entered into a new high school because I was in another town, still in Connecticut, and felt challenged. And I said, well, maybe I'll do it. So I ended up going to college at Fairfield University, Jesuit school. I'm a Jewish person and I'm in this very unusual setting, but it was really thrilling. And I will say, for those who have never thought about going to college, sometimes just challenge yourself. You'd be surprised that you might find something in there that you realize, wow, I can be pretty good at this. And this is actually, very fulfilling. So I ended up going there. And then my professors pushed me and said, you should consider graduate school. So I kept getting pushed. Sometimes we don't have our parental figures to do that, but there are other people in our lives that can, be our biggest supporters.
Sure. And what did you major in it? Tell us a little bit about your experience at Fairfield.
So at Fairfield U, I majored in psychology. I did know that I was always interested in psychology. And because of my experience with my mom going to support groups, I reached out to the support group leader and asked if I can do an internship, a college level internship. And they said, absolutely. So I ended up doing a year at this cancer support program. And it obviously made a lot of difference. It was hard, painful at the same time, because of course it brought back memories, but it set my career in motion, and I've never gotten off that path. It's been so important. So again, I usually say to my students, if you've been through something really hard, think about it as fuel for your journey, because this could really make your life very meaningful.
And I also think that your intuitive outreach and then engaging with experiential learning opportunities, internships, clearly had a major and positive influence on, your career. And I think that's another thing, particularly in my experience, here at Chestnut Hill College and at Mercy, a lot of first generation college students are working, and to some extent, the journey through undergrad is foreign at first. And there are challenges to engaging in those experiential learning opportunities that involve time and or finance. But they're just so critical. And I'm always telling students, do what you can, do whatever you can to volunteer, to get a part-time job in your own field or the field that you want to do, because that's how you're going to get your first job, and that's how you're going to learn what you want to do and what you don't want to do, which is also important. So tell us about you go from undergrad. What was next?
Can I just say one thing, that my program has internships for Bronx students of all backgrounds, whatever they're majoring in. So I do want to just say, if anybody's interested in working in the fields of cancer and cancer wellness and cancer outreach, they can always also reach out to me, because it's a great opportunity for them to get their feet wet if they have an interest. Yeah. So at college, I I was thinking about getting a master's degree in existential phenomenological psychology. And fortunately, and nothing wrong with that field, but my professor said, what are you going to do with that? You're just going to teach, because you can't do anything else with it. So I realized, I had to do something more practical, and ended up going for a doctorate in the field of health psychology. And a lot of people don't know that health psychology is a field of psychology that focuses on sort of the psychological aspects of medical illness. It could be, diabetes, heart disease. My area was oncology, so the subfield is called psycho-oncology. And it definitely is a thriving field all over the world. Not huge, but there are contingencies all over the world. And it really is important, because people living with cancer experience so many challenges, and we still kind of have so much to learn about cancer, and there's a lot of fear and stigma around cancer. So we're working to help, make people's lives better.
That's great. And where'd you do your grad work?
Yeshiva University. So I went from a Jesuit school to a Jewish school, and only because there happened to be, and it was part of Albert Einstein College of Medicine at that time, because Yeshiva was the umbrella school. It happened to have a very strong, and still does, health psychology program.
And with health psychology, when you finished your doctorate, do you do an internship, or what happens next?
Yes, I did a fellowship at Memorial Sloan Kettering Cancer Center. So Memorial has one of the strongest, best known fellowships, postdoctoral fellowships in psycho-oncology. So I worked with very renowned people. Jimmy Holland is the sort of grandmother. She passed away. She was the grandmother of the field, and I had an opportunity to work with her as well.
That's great. So if you were to say to someone watching this program, clearly you've faced significant challenge. You came through it. You've got a great career. You've been at two excellent institutions for your education and, your clinical training. What would the advice be to our listeners that might not be thinking about attending college or are on the fence? What would you tell them?
I'd probably say if you're on the fence and you're not sure what you want to do, think about what your interests are and do some kind of internship. It's a volunteer activity. Go and see what the field is like. Get your feet wet, go in there, ask around, ask people, interview people in the field. I've had students interview me to say, like, what do you do? What is a day in the life of your life like? I've had students shadow me. And the other thing I would say is don't listen to that little critical voice in your head. We all have it. And sometimes it says we're not good enough. We didn't have this. We weren't born with that. We didn't have, don't listen to that. You can do whatever you want if you want it. Just take one step at a time. You can make it.
That's great. Great advice, and a lot of really excellent points that you made, and that your journey sort of taught you and led to your success. I want to thank Dr. Alyson Moadel Robley for joining us today. I want to thank our viewers for tuning in. This is Public Health America. I'm your host, Dr. William Latimer. See you next time. Take care.